If you've been suffering from GERD or acid reflux, you're having pain in your chest, you know that you have burning, so you know you have acid reflux, but you're also getting heart palpitations. Maybe you have a cardiologist and you have a gastroenterologist, and you're sensing the connection between the two. Maybe when you eat, you get heart palpitations, or if you have a full stomach and you lie down, you get heart palpitations. Not always that they're correlated, but you start to see that they seem to be related. And especially when you've been to your cardiologist and they tell you your heart is perfectly fine, then of course you start saying, well, then what is it? Why am I having these heart palpitations? And it can be very frustrating when you're trying to tell one of these specialists that you think there's a relationship. So I'm here to tell you, you are right. If you have been ruled out as far as having heart disease, yet again, your specialists are telling you there's no relationship between the esophagus and the heart, they're incorrect. Now, I had a patient just yesterday where their cardiologist said, your esophagus is in no way related to your heart. And it really made me frustrated, and that's why I'm doing this video, because I know a lot of patients are putting this together, and you have to sort of become your own health advocate when this whole situation is driving you a little bit crazy and you've got the acid reflux, and sometimes you've got shortness of breath and heart palpitations and sometimes anxiety and panic attacks, and maybe you're constipated, you're bloated, you're pretty miserable. So, you know, when you're not getting help, of course you're going to start watching videos, you're going to do your own research, hopefully, because unfortunately in our healthcare system that's required a great deal of the time. So I do want to explain this. The esophagus is behind your heart. Your heart is on your left, as most of us know. The esophagus is more in the center, but the esophagus is actually attached to what's called the pericardium, or the sac around your heart, by some connective tissue. So they are literally connected. And when your esophagus gets inflamed, it does so because the stomach, lower down, also on the left, so heart on the left, stomach on the left. Even though the esophagus is in the center, the stomach kind of connects and then comes around off to the left of your body. And so as the stomach compresses, which of course is causing the irritation up your esophagus, because the stomach compresses and brings the acid upward, so that irritation of the esophagus and stomach, the phenomena that happens is that as the stomach compresses, it gets raised, it gets lifted up. And then the first organ that it runs into is your diaphragm, which is a sheet of muscle. And the diaphragm also attaches to that pericardium through some connective tissue. But as the stomach elevates and your diaphragm elevates, that's what causes the heart to start palpitating, because you're literally getting in its way. Okay, everybody has their position in the human body, but as the heart and the diaphragm elevate, now you're getting in the way of the heart, and these palpitations can occur. And so of course, if you haven't eaten for a while, you've been standing for a while, sometimes you're not feeling the heart palpitations because the stomach is relaxed. Some people are getting the heart palpitations kind of all day long, willy-nilly, because the diaphragm has gotten spasmed in that upward position, and that's creating the irritation. So there's a few different ways this can happen, but what I wanted to address today was specifically this complaint or query, really, that I'm hearing from new patients, which is, I'm really thinking that my gut is associated with these heart palpitations, but I'm being told that there's no evidence of that, and that is not true. So it's just basic anatomy and understanding what the phenomena is that happens with the acid reflux, and that's what we specialize in here at Root Cause Medical Clinic. So I wrote the book, Hiatal Hernia Syndrome. We have a number of videos on YouTube on this topic, so please, if you're having this discomfort and you're really getting nowhere, even if you're being medicated. So there's many videos I've done on the dangers of antacids, so definitely apprise yourself of that knowledge. People are being given medications for their heart to slow down the heartbeat. when there's nothing wrong with the heart. So if you go to a cardiologist and they check your heart out completely and you're told your heart's perfectly fine and here's your beta blocker to slow down your heart, that should give you a little bit of concern because you were just told that your heart's fine. Now, yes, you're having the heart palpitations, but it's not because your heart is malfunctioning. It's because your heart is being irritated. Different reason. So we really want to get you off these medications, which is not hard to do because we get to the root cause of the problem. So I hope that helps. If you enjoy this information, please give us a thumbs up and subscribe to the channel so more people can see this information. And in the description of this video, you'll see how to get a hold of us. We would be delighted to help, and I look forward to meeting you. Bye-bye.